Hey guys, I'm Dr. Ryan Burns with the Airrosti Rehab Centers. We're here at Pillar CrossFit in San Antonio, Texas today to give you another Mobility Monday. We got Coach Lindsay here. She's going to help demonstrate some of the exercises that we're going to be going over today. We're talking about knee pain. One of the most specific conditions that we see is patellar tendonitis. So we're going to be utilizing some mobility devices, the stick, lacrosse ball, and a foam roller, and show you some ways to not only alleviate the pain that you're experiencing, but oftentimes to get rid of the problem completely. So what we're going to be using first is going to be what we call the stick, okay? The stick is a good mobility device that actually allows you to mobilize the tissue, especially a quad muscle, on your own without the use of a lot of other devices. So Lindsay, I'm going to have you hold this real quick. So in order to use the stick correctly, what we're going to be doing, we're going to basically be rolling out the dough essentially. So what we're going to do, we're going to roll through the quad muscle starting at the very top all the way down to the kneecap without actually going over the bone itself. So go ahead and start that for me. So as you're applying pressure through here, you're going to feel some very tender areas. We're usually going to do this for about 2 or 3 minutes or until you feel the pain start to decrease. So Lindsay's going to continue doing this until she feels the pain decrease. Now oftentimes you will feel some areas that are much more tender than others. When that occurs, what you want to do is spend a little bit extra time, maybe 10 seconds longer on that area in a short back and forth motion. You should feel a decrease in your symptoms as you're doing this. If not, it's probably a little bit more progressed. You need to be continuing to do these exercises for another 2-week period of time, a couple of times a day. The next mobility device we're going to be showing you is the foam roller. Very commonly people see these at the gyms before races. We're going to show you a really good way to prevent the patellar tendonitis and the tightness in the quads from progressing utilizing the foam rollers. So what Lindsay's going to start to do, we're going to roll, we're going to crawl ourselves all the way up. We're going to work through that entire tissue. Just like what we talked about earlier, you want to make sure you're starting at the beginning of the quad, getting all the way down to the bone here, but not directly on it, okay? It's very important to get all the way to the top of the knee when we're dealing with knee pain. As you progress, once you're not feeling that very much in the quads, what you'll do, you'll actually lift your feet up. As you lift the feet up, it's actually going to allow gravity to press down on the quads and also allow you to get a little closer to the knee as well, to help with that knee pain. Areas that are very, very tender where there may be a knot, we're actually going to spend a little extra time there. And so what we can do with those, we'll just roll to that tender spot and we'll actually just sit on it. And you'll sit on that spot for about 10 to 15 seconds or until the pain starts to decrease. The last progression, once you're not feeling symptoms this way, you can actually cross one leg over the other, being very certain to stay neutral on the quad muscle and getting right in the middle of that muscle there, and continuing to roll. Again, this should be your very last progression, as this will create the most tenderness and definitely shouldn't be done at the very beginning of your treatment plan. The last mobility device we're going to use is one of my personal favorites, which is the lacrosse ball. Lacrosse ball is easy to travel with. It fits in a suitcase and you can work on these things even if you travel. So what we're going to do, I'm going to have Lindsay, you're going to lay face down. So we're going to place the ball here on the quad, right above the kneecap. We're going to flex the knee and begin flossing the tissue by extending the leg and flexing the leg back and forth. We're going to continue this motion for about 30 seconds to a minute or until you feel the symptoms start to decrease. Now with the lacrosse ball, the cool thing about it is you can get to some areas that you can't with the other mobility devices because of its size. So you're almost on a search and destroy mission for those tender spots. So what we want to do is continue to move this around the quad muscle, looking for those areas and repeating that flossing motion. You'll continue that all the way up the quad muscle until you get to the very top of the iliac crest. Continue rolling up. Good. Again, each of these areas, about 30 seconds to a minute until you feel your symptoms decrease. So today we utilized 3 of our favorite mobility devices in order to mobilize the quad muscle, which is one of the major problems we experience when we have patellar tendonitis or Osgood-Schlatter's. So we utilized the stick first, the foam roller, and lastly the lacrosse ball in order to mobilize the tissue. If you're not noticing a decrease in your symptomology or the pain is getting worse when doing this, please contact your nearest certified Airrosti provider in order to get symptom relief. We also want to thank you guys for joining us for our Mobility Monday today, and be sure to join us for the next one.